if you're buying everything on Amazon, if you're ordering food without visiting a restaurant, why not healthcare?
If human beings will become more smarter, that is when AI is valuable. Otherwise, AI will become an enemy for that person.
Books are written by people who had experience and who are able to impart knowledge.
You have been in this information technologies almost 40 plus years. You have seen from where it began and where it is now.
If AI takes all the jobs, then where is humanity? If there's no humanity, where's AI?
What is your perspective on healthcare innovation and digitization in India and the world?
Hi everyone, I'm Mohsinaa Ahmad. Welcome to Boss Talks, where transformative conversations meet actionable insights. In each episode, we have conversations on the intersection of modern leadership, exploring how spirituality shapes decision-making, how sustainability drives innovation, how technology transforms business, and how emotional intelligence powers lasting success. I'm really happy to welcome Haresh Ahuja with an impressive 45-year journey in information technology. Haresh currently serves as partner of IT services at RSM AE Technology, where he has been transforming business technology solutions since 2018. Our founder member of the Middle East Oracle user group, Haresh has established himself as a cornerstone of the UAE tech landscape. His career spans remarkable leadership roles, including general manager positions at Axel Frontline and Gulf Computers, and founding ventures like Sigma Data Products. What distinguishes Haresh is his commitment to tailored solutions over cookie-cutter approaches, aligning technologies with specific customer needs. His expertise in IT operations, enterprise software implementation, and vendor relationship management has driven success across numerous projects. Beyond his professional achievements, Haresh brings valuable perspectives as a startup mentor and investor with an exceptional track record of successful entrepreneurial partnerships throughout the Middle East. Hi Haresh, welcome to Boss Talks. How are you doing today?
It's good to be on a call with you.
Haresh, what inspired you to build a remote ECG and health monitoring, especially at this stage of your career when you have done it all, achieved it all, and you are building something so innovative?
Mohsinaa, age for me is just a two-digit number. It's just a two-digit attribute on your HR system. Basically, we all born with a definitive end, but at the same time, if the life is not purposeful, what are we doing? And why should we be wasting time? Say, I'll go for a walk, but that we should be doing continuously, isn't it? For the upkeep of our health. Now, what happens is COVID taught us to work from home. If you look at it, it's not that in COVID, we became innovative. No, we started using the tools which are available to us in a manner which helped the whole humanity. Otherwise, given the dimension of a pandemic, the whole world would have shut down. But if you look at it, we all prospered during that time. And that work from home culture continues with so many enterprises, MNCs now challenging their employees to come back to work. Now, coming back to healthcare. Now, my saying is, if you're doing everything remote, if you're buying everything on Amazon, if you're doing a grocery on the Swiggy or any other system, you're ordering food without visiting a restaurant, why not healthcare? Now, the important aspect which came to my mind is, globally, if you look at the rural population outweighs the urban population. And if the rural population health is taken care of, I think we achieved a great journey. If you look at it, the UN Sustainable Development Goals, there are 17 goals. Goal number 3 says well-being of the citizens. Well-being of every person on this planet. So that's what we thought is that if we are able to reach healthcare in time, we'll be saving so many lives. Second thing is, if we're able to monitor the health remotely, we'll be saving so much of cost, energy, and of course, in this world, when you're talking about carbon footprint, we'll be saving so much of carbon footprint for people not to travel, not required to travel. Apart from rural healthcare, if you look at it, if you're able to set remote OPDs, where a patient need not go and crowd the OPDs. Now, it's not that patient should not see the doctor, but what happens, we all fail to understand that when you visit a hospital, there is a chance of getting infection from unknown pathogen. And we have seen people who are recovered after lengthy operation procedures. They recovered in the ICUs, and when they are shifted room, suddenly they collapse, suddenly they're infected, and suddenly you're not able to save them. These are the unknown pathogens which cause infection. So considering these 2 points, first is rural health and remote OPD. That's how we came across of clean and usable telehealth example. During COVID, the concept of telehealth was just calling a physician over the phone, and the physician will ask you a few questions, yes, no type of thing, and then that's it. He'll send you a prescription and you fill the prescription. But here, what we're giving is we are able to measure the vitals. The vitals are able to reach the physician in real time, including listening to the oscillation from the stethoscope, seeing the images of ear, nose, and throat, conversing with patient on a video call, so the doctor can examine patient virtually and see the physical appearance of the patient. Generally, when you go to a GP, this is where the AI also will come in future, and definitely it is coming in some part, in some form and shape. When you go to GP, what does GP do? He looks at your appearance, he looks at your eyes, he sees whether you're able to stand properly or you've got a temperature, how is your blood pressure, how is your heart rate, and then he takes a stethoscope and starts listening to the oscillation from your heart, lung, abdomen, back. While by the time he has completed the examination, okay, he has made up his mind. In his mind, his AI is working to find out, the diagnosis tells him that what is the patient's ailment. And how does he know that? After studying for 5.5 years in a college, where he's taught about the body anatomy, and he's taught about, how the blood pressure, how the heart rate, how the appearance will vary for a person for different ailments. So when he's examining patient, his mind is working. And if you look at it, what we do in AI, we create patterns. We just look at the patterns, we create a repository of patterns, and then we see which pattern is matching. That's what the AI gives you a response. So this is what we want to put it together. And we thought, yes, why not? And we are finding there is a lot of acceptance from the industry, acceptance from NGOs, acceptance from the government bodies. And this is what you're talking about is the primary healthcare.
Right.
If you look at public healthcare, also we are able to put a solution together where we are able to diagnose all the communicable diseases, including biomarkers and including the substances. Drugs is another issue. If you are able to detect all this, the communicable diseases, the biomarker and the substances within less than a minute, haven't we achieved what we want to do for humanity?
Absolutely, absolutely. So this seems like a very, very remarkable invention in, science and medical. Do you have a team who is doing it with you?
Yes, we have a team. We have built up our own software platform from scratch. Right now, we are concentrating on the nuts and bolts. We say in IT, keep the lights on. In the sense is, we are able to measure the vitals and pass it to physician, and the physician can order a prescription online, and we can look at we can fill the prescription online by tying up with pharmacies. That work we started, we've done POCs, we are doing test cases. Now we've conducted camps, we have gone to defense forces. So all this data has been collected, and now when we tested the data, now we are at the stage that yes, we should go to the world. While the world is using this equipment, we should start building up AI engine along with a set of physicians, along with a set of medical fraternity.
So the trademark and the patent and everything is in place?
Is getting in place.
Do you have a name that you have decided for this?
At this point in time, I would rather refrain myself, because we have yet to make up our mind, because how we want to position this in the market.
So if someone is not quite tech savvy, and we see it in rural areas more, and most of the population who are above 60, they're quite slow when new technology is concerned. So in simple terms, if you have to explain someone how this ECG device works.
See, you cannot go to rural health without taking the help of NGO. The NGOs are the one who develop trusted communication with the rural population.
Right.
Any NGO volunteer, when he visits a village or a small little cluster of houses, they trust him because they trust that person, because the person has been in touch with them, the person has been helping them through the thick and thin of a crisis. Okay, so we don't expect the persons to be knowledgeable. We don't expect them to invest. We are saying that if an NGO carries our equipment, and our equipment has a provision to have a SIM card, So with all the connectivity or global connectivity around through mobile, so at least that portion of communication, the last leg of communication from the collecting vitals to the physician is being taken care of. Coming forward, we can, charge these devices through solar. So we are using sustainability. It's more not because sustainability, but no more because of convenience. Let's say we get power outages in rural areas. Okay, some of the rural may not also be not having the facility of electricity. Of course, now it's rare, but we are able, we have thought about it, all the risk factors, because we do not want to be any roadblock in this job.
Right. So, Harish, what's the real world impact you see this device having, especially for elderly in all sectors, not just rural areas, because you're not just targeting rural areas, you're also targeting urban areas. So, what is the real world impact that it's going to have?
Okay. So I described you the scenario of rural health, but it doesn't forbid us not to go to urban area. One of the things is, if you look at it, we have lived in the nuclear families, very small families where most of us, if you look at it, we are outside country and we got some, old persons at home to be looked after. Okay. Maybe let's take the example of old age homes where there are, let's say, 100 people living in a cluster of rooms or houses, etc. And there are set of care providers who look after them, after their well-being. So those care providers can be in touch with the doctor in case of emergency. Second thing is, even in case of a normal person, God forbid, if there's an emergency, the doctor, the physician on the other side is able to get the vitals in real time. So before the ambulance reaches the hospital, they are all ready for the course of treatment which the patient should undergo to save the day. In medical terms, you would have heard of a concept called golden hour. It is said that within 1 hour's time, and then during golden hour's time, if you are able to reach help to the patient could be saved.
Right.
So this is what we are trying to utilize. So rural health, I told you from the perspective because there's a need for the hour. And second thing is, we're only spending a fraction of cost. Now, aligning technology, let me put it on the other side also. Let's say you got a call center of doctors. They might be interns. Okay, they might be from different areas. Like I know in some of the states in India, they set up Ayush call centers. Okay, at the district level. Now, what we are saying is every patient, every person has got a different level of thresholds as far as your heart rate is concerned, as far as blood pressure is concerned, ECG is concerned, as far as oxygenation is concerned. You have threshold levels which the body can bear, the upper and the lower threshold level. What we're doing is, in case vitals is away from threshold, we raise the alarm. And that alarm goes in real time to, let's say, to a call center.
It's an automatic alarm?
Is automatic alarm. The moment you measure vitals, it tells you whether blood pressure low, high, normal, because if the patient is being monitored continuously, we know the trend of the patient, whether the rising trend or lowering trend. Both can be hazardous in case of healthcare. Low blood pressure also is an issue, your high blood pressure also issue. Your low pulse rate also issue, your high pulse rate also is issue. So if it's away from threshold, we are able to capture it and we are able to, deliver the data to the physician. On the call center, it will decide if, let's say, we set up the rules where the threshold of 1%, 5%, 10%, away. We can decide who should manage the call. Okay. And if the patient is really doing good, for example, old age home where we are monitoring their vitals on a continuous basis, somebody could call them and pep them, look, you're doing extremely well, keep on doing what you did yesterday. And in case the vitals are away, the first thing they'll ask the patient, what went wrong? What did you do yesterday different than what it was day before? So that information is captured and that information will help the physician to provide a course of treatment. So it's not only rural, but we look at the rural, we are saying it because, a lot of money needs to be spent otherwise in sending people and equipment to the rural villages. In case of urban, this is not required. Let's take the case of large hospitals. We have seen crowding of OPDs, how OPD, the crowd and the doctors are extremely busy. And 70% of cases, including you and me, sometimes we go to a doctor just for our mental comfort. The doctor said, yes, everything is fine. We come home happy and, we are fully charged. Now, unfortunately, in that crowd, the person who really needs attention of doctor, his case is being diluted. Because if you look at the law of statistics, he's one among many there. But we set up a remote OPDs where, there's an intern or there's a pharmacist who collects the vitals and he in real time, he converses with the doctor at the back end. And the doctor decides the patient should come to OPD. Only those patients couldn't go to OPD.
Right.
And even from a sustainability perspective, if you look at it, we can reduce the size of OPD. We can reduce the size of power, electricity consumption. We can reduce reduce the size of infrastructure to accommodate that sort of crowd, which is otherwise being handled from remote OPDs. And the patients also need not travel. They can also save time. So it's a win-win situation.
This plan that you have looks amazing, but where is the funding coming from? Are you seeking funding? Have you gotten a go-ahead in terms of the health ministry?
First of all, any medical equipment has to go through registration. It has to go through regulators' approval, which we have for a few countries. Okay. The funding is purely from out of our pockets. I feel passionate, and fortunately, I'm at the juncture of world where I don't have any EMI to pay. I don't have any children to go to school. I don't settle any child, don't get them married, etc., etc. God has been kind. My children have been provided with whatever they need in life. So why don't I put something which I can give it back to the society? That's what the purpose I started. And when you go for funding agencies, okay, first of all, when somebody looks at a 70-year-old person, he thinks, why the hell he needs funding? Why is he getting in this project? It's purely from passion, purely for leaving a legacy behind, and purely from humanity. Yes, there is a commercial angle. There will be always a commercial angle. If there's no commercial angle, there won't be any motivation, and the project will never work. So I would rather tackle commercial once I'm ready.
Non-retirement mission, work till whatever time we are here.
You have been in this information technologies almost 40 plus years. You've seen the innovation, you have seen the growth, you have seen from where it began and where it is now. What is your take on that? Please share your journey.
Mohsinaa, we have seen the digital journey started with simple email. I'm the fortunate one who has been at the hem of the technology when it's going through transformation. Just to give you an example, are you aware that somebody got a PhD for displaying a character on a CRT screen? It's in the name of Dr. PVS Rao. He got a PhD for displaying a character on the CRT screen. Today, we are displaying our images on a screen. Just look at the journey, what the technology has evolved from. And I've been right at the center of that, witnessing the technology for where it was. I worked with punch cards. I worked with, magnetic tapes. I worked with the diskless environments. Okay, from that journey, coming to, personal computers, coming to the virtualization, coming to the, data centers, coming to cloud, mobile. It's been a journey. And this journey has really inspired me. When I started my career on 1st September 1976, I never seen a computer before that. So I was an intern. I stepped into a computer room, freezingly cold, 18 degrees centigrade. In front of me, there were 4 tape spools moving around, 2,400 feet of half-inch tape. On the right side, there was a printer with a churning paper. Just next to it, there was a card reader. It was reading cards. And in the center, there was a console, a teletypewriter console with chattering around. I said, what? Am I in a sci-fi? So that night I didn't sleep. But I vowed myself that, I would never leave computers until the time I move to cloud. And maybe when I move to cloud, I'll force the Almighty he should go digital.
What is your perspective on healthcare innovation and digitization in India and the world?
Even healthcare has gone to digitalization. If you look at it, let's take the case of radiology. Radiology since 2002, 2003 has become, it has gone digital. After the images were digital, they were sent across to radiologists around the world for the, because to save on cost, reduce labor rate. And the radiologist on the other side was giving his opinion. See, generally when you go to radiologist, the radiologist doesn't prescribe you anything. He doesn't even look at you. He doesn't even meet you. You go to a room, you take an X-ray, MRI scan, CT scan, any scan, ultrasound. Okay, you come out, the report is there, and the radiologist tells you, come and take the report in the evening. Not in radiology, somebody at the reception. You come in and he says, in my opinion, I find. You look at what happened in the imaging industry. We had photographic cameras, and we all were so fond of having a camera. As a child, I used to love to have a camera. That went digital. What happened? All the filmmakers, they went belly up. Some of them, like Kodak, they remained behind because they went digital. They created digital imaging. They are the ones who created, the radiology imaging. If you look at it, you go for X-rays, generally the films are Agfa films or Kodak films. So they also transformed to digital journey. And then they started with radiologists, etc. So the digital journey in healthcare is already there.
Haresh, please tell us, what are your views on AI and innovation?
Okay, we know AI is going to touch every aspect of our life. The books are written by people who had experience and who are able to impart knowledge, transfer knowledge to the reader. Over a period of experience, they were taken from other books, they were taken from other publications, etc., and created a book on a topic. What AI does, we look at the historical data, we find the pattern, and that's the reason we put a word of intelligence, so artificial intelligence, because in our case, when we learn, we also have cognitive thinking, where we have emotional thinking, where we can, look at the, decision making from a different side. Whereas here, it's a purely digital. Is it matching? not matching. If it's matching, how much it is. If it's not matching, how much it is not. That's all it is. And again, the fear that AI is going to take the jobs. No. If AI had to take over the jobs, the AI would have, even from the calculator age, the job would have been lost.
This is amazing because, AI, it is taking over many things, and people need to innovate themselves and adapt themselves and probably upskill themselves to use AI and become more smarter. Because if human beings will become more smarter, that is when AI is valuable. Otherwise, AI will become an enemy for that person. So they will always blame, they will have a thing to blame AI that, because of this coming in, this happened. So that should not happen. You should learn and utilize that, upgrading your skill set.
When the wheel was invented, probably, and wheel was not invented in one culture. Wheel was invented in multiple cultures around the same time.
Yes.
That time, probably the world population would have been few millions. Okay, the concept was, what we call a SME today. Everyone, it was a micro industry, micro concept, setting up small businesses, etc., etc. And before that, people were carrying all the load on their head. When a wheel came in, everything changed. Look at it. A person, I'm not trying to sort of disrespect any profession. If you look at the Uber driver or the taxi driver, what he's using? He's using wheels. He's upgraded himself to use wheels.
Right.
So we are transformed, right? We are transformed in a journey. We had a very outdated telephone system in India with the rotary dials. I don't know whether you've seen those phones, etc. Then we gave them, the digital for the punch phones, where you are punching numbers. And then we come to mobile. Have we lost jobs? But what has happened is at every stage, we have optimized our time, we have optimized our resources, we optimize ourselves so that we are giving us our time to be more innovative.
True,
So
absolutely.
AI will never take, for example, in 80s, computers came in. There used to be bank strikes in India saying that they are going to take over jobs. Today, if you look at it, the number of people employed in banks are far, far more what those were in the 80s. And everyone is using online system. Everyone using digital system. And the amount of business transaction have grown exponentially. My take on, AI, if AI takes all the jobs, then where is humanity? If there's no humanity, where's AI?
That's absolutely true. Some jobs will become obsolete, but there will be better jobs coming in, and skilling is important. So that's amazing of you, Haresh. Thank you so much for joining in.
It's been a pleasure.
Mine as well.
Yeah.